Today, the world celebrates the Sickle Cell Disease Day. Sickle cell disease is an inherited disorder that affects up to 7.7 million people, and it has a very high burden in sub-Saharan Africa and in other regions where you have a high burden of malaria. And especially in pregnancy, you have a high risk of maternal death in patients with sickle cell disease, with the risk up to 4 to 11-fold higher than in those without sickle cell disease. So the emphasis today is on better management and better understanding of the disease to allow better therapeutic approach to the challenges of people living with the disease. And the good thing is that today also, in commemoration of this event, the World Health Organization just released guidelines for the management of sickle cell disease in pregnancy. And the guideline focuses on four major areas. One, the management of the disease in pregnancy, in patients presenting for antenatal care, the use of medications like folic acid, and also guideline on how to use iron therapy and blood transfusion as well. Then secondly is management of pain in patients with sickle cell disease. We know that pain is a major factor in these patients. And the third is management of patients with sickle cell disease on admission. That's hospitalized patients with sickle cell disease, especially the emphasis on thrombophilaxis to prevent the formation of blood clots. And the last is inter-pregnancy management between one pregnancy and another. What do you have to do? What are we expected to do in terms of contraception and in terms of preconception care and other forms of therapeutic care that may be needed during that period? But the question we'll ask ourselves is, why do we still have a high burden of sickle cell disease in sub-Saharan Africa? Despite the fact that this is a preventable disease with proper care, with proper diagnosis, especially premarital diagnosis, we know the challenges we have with treatment, challenges we have with poor access to healthcare. So despite the fact that we have improvement in care for sickle cell disease, but most people in sub-Saharan Africa don't still have access to care. So our best bet is prevention. So how do we ensure that people get tested before they engage in any form of sexual or marital relationship that may lead to pregnancy? So this should be our focus in Africa, even as we look at the global issue of better management. Our emphasis in this part of the world should be on prevention. The burden is high, the burden is much, and we need to do our best to prevent this disease.